Good afternoon, folks. Today for A, for today for A, we are discussing curbing the CNA workforce shortage. Okay, so I'm going to do a little presentation for you on that. So please join me for presentation A. Here we go. Titles: Curbing the CNA workforce shortage. The crisis in America The crisis, the crisis in America's long-term care system is not a temporary staffing hiccup. It is a structural failure that threatens the safety, dignity, and basic care of millions of older Americans. Certified nursing assistants, CNAs, provide the vast majority of hands-on care in nursing homes. Yet the profession is chronically underpaid, under-resourced, and under-respected. If policymakers and healthcare system leaders do not act now to fix pay, expand training pipelines, build career ladders, and fund mental health and safety supports, we will watch the long-term care sector shrink until it can no longer meet demand. why this is why this is a structural crisis. CNAs are the backbone of nursing homes and many home care programs. They bathe, feed, mobilize, and comfort residents. Despite this, the job is characterized by low wages, irregular schedules, limited benefits, and high physical and emotional strain. The pandemic accelerated an already dangerous trend. Facilities lost hundreds of thousands of direct care workers. Turnover spiked, and many nursing home beds were closed because operators could not staff them. These are not isolated problems. They are system-wide failures. That require systematic solutions for for mutiny mutiny reinforcing priorities. Addressing the shortage means attacking the problem on four fronts at once. Piecemeal fixes will only shift the kern, raise and stabilize compensation and benefits. Low pay is the single most powerful driver of exits wage floors tied to resident acuity, and guaranteed benefits such as health insurance, paid time off, and retirement contributions will reduce the current and make CNA work sustainable. Targeted targeted differentials for dementia care, behavioral health, and high acuity units. Recognize the skill and emotional labor required and help retain staff where they are most needed. Expand accessible training and paid pipelines. Barriers to entry are real. Training costs, transportation, testing access, and scheduling conflicts. Free or subsidized CNA training, paid apprenticeships with guaranteed placement, high school, dual enrollment pathways, and mobile testing units for rural areas will widen the pipeline. Grow your own programs embedded in facilities, create local, loyal workforces, and reduce recruitment costs over time. Build real career ladders. Retention collapses when CNAs see no path forward. Fund bridge programs that let CNAs advance to medication technicians, LPNs, and RNs with tuition, support, and paid clinical time. Create skill-based pay increases for certifications in dementia care, restorative nursing, and wound care. Promote experienced CNAs into leadership roles such as preceptors and team leaders, team leads, so institutional knowledge is preserved and rewarded. Invest in workplace safety and mental health supports. The emotional toll of direct care is profound. Violence, violence prevention protocols on site are or telemental health services, peer support groups, and paid decompression time after traumatic events are retention tools. Not luxuries. Minimum staffing ratios and team based care models reduce burnout by distributing workload and improving continuity of care. Implementation roadmap. Short term 0 to 12 months. Deploy emergency wage supplements tied to Medicaid rate adjustments. Seed regional CNA academies and create surge staffing pools for crisis periods. Medium team 1 to 3 years. Scale paid apprenticeships. Embed CNA pathways in high schools and community colleges. And fund bridge programs to LPN and RN credentials. Long term, 3 to 5 years. Institutionalized wage floors, career ladders, and routine mental health services as quality matrix tied to reimbursement and licensure standards, trade-offs, and fiscal reality. Meaningful reform costs money, sustained wage increases, and benefits require durable funding streams such as Medicaid rate reform, state appropriations, or targeted workforce incentive levies. Policymakers must avoid unfunded mandates that force small rural providers to close, pair staffing standards with targeted financing and technical assistance so smaller operators can implement appropriate apprenticeships and mental health programs without collapsing. A final a final imperative. We treat CNAs as a, a variable cost to be minimized rather than a public good to be sustained. That calculus is failing. Residents, families, hospitals, and communities, the alternative to investment is fewer available beds, longer hospital stays, and families forced into crisis decisions. The solution is straightforward in principle and complex in execution. Pay people a living wage, give them a path forward, and support their mental health and safety. Do that, and the workforce will stabilize. Fail to do it, and the long term care system will continue to unravel. Act now, stabilize the workforce, protect the people who care for our parents and grandparents. The CNA workforce crisis is not a staffing shortage, it's a structural failure that threatens the stability of long term care across Pennsylvania and the nation. Fixing it requires coordinated investment in wages, training pipelines, career mobility, and mental health and safety supports. Below is a full narrative essay that weaves the human reality of CNA work with the policy strategies needed to rebuild the workforce. Strategies to improve the certified nursing assistant workforce crisis. The title is The Human Center of Long-Term Care. Every morning in nursing homes across Pennsylvania, from Meadville to Erie, from Pittsburgh to Scranton, certified nursing assistants begin work long before the rest of the world wakes. They lift residents gently from bed, bathe them, help them dress, feed them, and steady their hands when tremors or fear make simple tasks difficult. They are the ones who notice subtle changes, a new confusion, a quiet withdrawal, a bruise that wasn't there yesterday. CNAs are the eyes, ears, hands, and heart of long term care. Their work is intimate, physical, and emotionally demanding. It is also indispensable. Without CNAs, the entire system collapses. And today, that collapse is already underway. A crisis years in the making. The CNA workforce crisis did not begin with the pandemic, but COVID-19 accelerated every underlying fault line. Low wages pushed workers out. High injury rates made the job dangerous. Limited training access, especially in rural regions like Northwest Pennsylvania, kept new workers from entering the field. And the absence of career mobility convinced many CNAs that staying meant segregation. The result is a churn so severe that some facilities replace their entire CNA staff every year. When CNAs leave, residents feel the loss immediately. Unanswered call bells, rising pressure injuries, no longer waits for basic care. Hospitals feel it too as discharge delays ripple through emergency departments and inpatient units. This is not a temporary shortage. It is a structural failure, and it demands structural solutions. Why traditional fixes haven't worked. For years, policymakers and providers have tried piecemeal solutions, sign on bonuses, recruitment campaigns, temporary, temporary wage boosts. But the CNA crisis is not a single cause problem, it is a four-part system failure. And unless all four parts are addressed together, the shortage will persist. Those four parts are compensation. CNAs cannot build stable lives on poverty wages. Training access. The pipeline collapses when tuition, transportation, and testing become barriers. Career mobility. Retention requires a path forward, not a dead end. Safety and mental health. Burnout becomes inevitable when trauma is routine and support is absent. Fixing one without the others is like patching one leak in a sinking boat. Four strategies to rebuild the CNA workforce. 1. Raise and stabilize wages and benefits. CNAs must be paid a living wage that reflects the physical, emotional demands of, of their work. Wage floors tied to resident acuity paired with guaranteed benefits like health, insurance, paid time off, and recruitment contributions. Reduce the current and allow facilities to complete compete with non-healthcare employers. Build pay build paid accessible training pipelines. Training access is one of the largest barriers to entry. Solutions include regional CNA academies, mobile testing units for rural counties, transportation stipends, high school dual enrollment pathways, paid apprenticeships with guaranteed placement. These remove financial and geographic barriers and widen the pipeline, create funded career ladders. Retention collapses when CNAs see no path forward. RN pathways with tuition support and paid clinical time transform retention, skilled based pay for dementia care, restorative nursing, and behavioral health uh, competencies, professionalize the role and reward expertise, protect CNA from harm, direct care work is emotionally and physically demanding. Facilities must implement violence prevention protocols. De-escalation training, tele, tele, telemental health access, peer support groups, paid paid decompensation time after trauma events, staffing ratios tied to quality matrix. The stakes for Pennsylvania: if we fail to act, the consequences will not be abstract. More nursing homes, more nursing home beds will close. More families will be forced into crisis. More hospitals will gridlock because they cannot safely discharge patients. And more CNAs, the people who hold the hands of our parents and grandparents, will walk away from a profession that has asked too much and offered too little. But if we choose differently, if we pay fairly, train wisely, promote boldly, and care for the caregivers, we can rebuild a workforce worthy of the people it serves. The CNA workforce crisis is solvable, but only if we act boldly, structurally, and with the moral clarity that caregiving work deserves. The future of long term care depends on the choices we make now. Okay, guys, that is your A for this afternoon. I'll be back on with B shortly. Give me a bit for a break. I'll be back on with that for you. For now, Gator Wellness, take care, folks.